my final capstone presentation. And here are like the three, this is like the table of contents. Here are the three careers that I chose. Is nurse practitioner, clinical laboratory technologist, and PTA or physical therapist assistant. And then we're gonna skip over the collection. So my first career is nurse practitioner, and nurse practitioners are like, okay, don't mind how like pixelated the image is. I'm sorry, I don't know why it's that pixelated, but nurse practitioners are like a specialized form of nursing. Like they're specialized nurses. They're considered advanced practice registered nurses. And I guess the difference between like regular registered nurses and nurse practitioners is that nurse practitioners have more autonomy. So they have the freedom to, I guess, like diagnose their own patients. They can write treatment plans, order tests, all that. They get more autonomy. And here's like a picture of, if y'all can see it, here's a picture of a nurse practitioner comforting her patient. Most likely, like assuming from the picture itself, it's probably like after the patient came out of an operation, so there's that. And here's like all the logistics. So education requirements for a nurse practitioner would be a bachelor's degree in nursing, and then completion of a master's degree with clinical rotations, clinical trials. And then you need to pass national exams like to become certified as a nurse practitioner. And you also get on the job training. Blessing. So here are all the salaries. It can range from 60,000 to 100,000, with 100,000 being the highest. And then the benefits are like if they're a high salary, you get more independence. You again autonomy. You have more workplace autonomy. You get direct patient care. You can directly work with patients. And there's a high demand for this job. But some of the challenges of this job would be it's a very stressful work environment. It's very stressful, it's very physically demanding, and it can be really, you can get easily burnt out. So the career of nurse practitioner directly connects to healthcare because nurse practitioners are nurses and they directly handle patient care. So I guess that's what. So my next career is a clinical laboratory technologist. So clinical laboratory technologists work behind closed lab doors to run tests. Some of the responsibilities include analyzing bodily tissues, bodily fluids like urine, blood, like tissue samples, or like skin grafts. I think that's what, yeah, skin graft. Yeah, skin grafts. They analyze that to help, I guess, like understand what's going on with the patient. And they share this information from all their laboratory tests with physicians so that the physicians and doctors can help make an accurate diagnosis. So here's a picture of a clinical laboratory scientist, or technologist, sorry. And they're wearing PPE to protect themselves from the hazardous substances that they are exposed to. And they also don't want to contaminate the substance. And they're kind of like running tests. It's kind of hard to see, but they're using laboratory technology to run a test on a patient's body samples. So here are the logistics for education and training. The minimum educational requirement is an associate's degree in science, but some require a bachelor's degree, not all of them. The minimum, again, is just an associate's degree. And then the annual salary ranges from 30,000 to 80,000, with 80,000 being on the higher end. Some of the benefits is that you kind of work, if you like to work independent and like don't like to interact with patients directly, then that would be like better for you. If you don't want to talk to patients, then you can just work independently. You play a vital role in diagnosing and the treatment plan, and it's a lot of hands-on work. Some of the challenges would be that you're exposed to really dangerous materials. You might contaminate or get contaminated in a sense, and it's a lot of responsibility. If you mess up in your laboratory test, then like the entire diagnosis might be inaccurate. So it's really important. And clinical laboratory technologists directly connect to healthcare because they work behind closed lab doors to help diagnose the patient. So, yeah. And then my last career is a PTA or physical therapist assistant. So physical therapist assistants, they're sometimes called PTAs. They kind of help patients with their mobility, physical therapy. They kind of like help out the physical therapist. Sorry, I'm just moving my eye. Should we?
You can keep going.
Let's just keep going. Okay. So as I said, they observe patients before, during, and after therapy, and they help out the physical therapist with their treatment plan. And yeah. So here is a picture of a patient and a PTA kind of helping the patient out with the range of motion stuff. And yeah. So here are the logistics. So the educational requirement, it's more like vocational school and training, on-the-job training for the educational side. The salary ranges from $50,000 to $80,000, with $80,000 being on the higher end. And the benefits are it's a shorter education pathway, if that's interesting to you guys, and it's hands-on patient interaction. And then challenges are it's very physically demanding. You're actively helping the patient. It's direct patient interaction, so it might be physically demanding, and you don't have as much autonomy. You're mostly kind of following orders from the physical therapist, carry out their treatment plan. You don't really make up your own treatment plan for a patient, so you don't have as much autonomy as the physical therapist. That's okay. So how this career connects to healthcare is that PTAs follow the orders of the physical therapist to help help out with the patient. And I guess, yeah, that's kind of it. And that's it.